You're enjoying a weekend, maybe swinging a golf club or tending the garden, when sudden, sharp pain or deep stiffness brings you to a complete halt. This guide is brought to you by The Best of Health, the UK's trusted resource for over-50s navigating health and well-being decisions. That sudden stiffness is often the first sign of a condition called spondylosis, also known as spinal osteoarthritis. But does normal, age-related wear and tear mean you are locked into a future of continuous pain? While growing older guarantees biological changes to the spine, a life of disabling suffering is not the inevitable outcome. Your spine is a column of bones, called vertebrae, separated by soft cushioning discs. As we age, these discs dry out, losing volume. To compensate, your body produces extra bone, building small lumps, bone spurs, to stiffen the weakened areas. This specific physical combination, the shrinking of the rubbery discs and the rigid locking of those compensatory bone spurs, is the definitive mechanical cause of an aging, stiffening spine. This data visualization highlights how common this process is. Out of 100 people, 95% will develop spondylosis by the age of 65. Depending on where this structural wear occurs, doctors classify it differently. Cervical spondylosis refers to changes happening right in your neck. Thoracic spondylosis identifies the same process occurring in the mid-back, and lumbar spondylosis targets the vertebrae in the lower back. Nearly every human will develop these biological changes in at least one of these regions. Yet having the condition on an X-ray does not mean you will actually suffer from it. If 95% of us have this physical wear and tear, why do only a fraction of people actually experience symptoms? The answer lies in specific risk factors. Carrying excess weight, obesity, a lack of exercise, or living a highly sedentary lifestyle all place uneven, excessive stress on the spine. Your physical history accelerates the breakdown. Previous spinal surgeries, past injuries, and the repetitive strain of carrying heavy weights for years compound the damage. Even systemic and psychological factors, such as severe arthritis or dealing with high levels of anxiety and depression, correlate heavily with how intensely the pain is felt. It is an individual's daily habits and personal medical history that act as the catalysts, tipping the scale from silent biological aging to an active daily struggle. When spondylosis is active, the physical signs are clear: intermittent joint pain, acute morning stiffness, muscle spasms, and frequent headaches. Patients can also experience severe mechanical issues, including a troubling loss of balance while walking or a distinct grinding sensation in the spine itself. The most severe issues start when those newly formed bone spurs grow large enough to press directly into the delicate spinal nerves. This nerve impingement causes localized pain and sends incorrect signals outward, resulting in numbness, tingling, and weakness radiating down your arms or legs. Your daily experience is entirely dictated by whether your spinal changes are merely stiffening the joint or actively interfering directly with your nervous system. Fortunately, the vast majority of cases only produce mild, occasional stiffness and never require heavy medical intervention. The frontline defense is straightforward: stay physically active and manage any temporary inflammation with over-the-counter painkillers and non-steroidal anti-inflammatory drugs like ibuprofen. For pain that becomes persistent, doctors have a clear escalation path. They might prescribe a higher dose painkiller like codeine, muscle relaxants, or utilize targeted steroid injections to forcefully reduce the swelling. Surgery is kept strictly as a last resort. In those rare instances, a surgeon might remove the specific piece of bone pressing on the nerve or insert an artificial replacement disc. The medical community treats spondylosis through this tiered lens, only stepping up the interventions when the pain severely restricts a patient's daily life. While there is no cure for an aging spine, the good news is that correct daily management makes life significantly easier. The quickest way to reduce pressure on your spine is to reduce the load it carries. Losing excess weight, avoiding sudden movements, and resting during flare-ups immediately eases the strain. When the pain subsides, focus on building core stability. Low-impact restorative exercises like walking, swimming, and cycling strengthen the muscles supporting your spine without subjecting the joints to heavy impact. You can also utilize supplementary therapies at home. A TENS machine, for example, is a safe way to help relieve your pain in the comfort of your own living room. An aging spine is universal, but by making informed lifestyle choices and utilizing targeted treatments, your mobility and comfort remain within your control. For more guides on spondylosis, spinal health, and choosing the right care, visit The Best of Health at thebestofhealth.co.uk.